Good morning, doctor. Thank you very much for being here on the
Good.
show. I'm very excited to have the chance to talk to you today and very grateful for you.
Good morning, Reda. It's my pleasure to be here, right? For me, it's an honor and pleasure to be here with you. I want to say congratulations for your job, for your
Thank you, doctor.
podcast. You're doing a brilliant job helping other people to live better, right?
Thank you
Which
very much,
really
doctor, for that.
resonates with me.
All right, doctor. So let's start the conversation by a very simple question. Who is Dr. Annelyse?
So, I'm an ENT doctor, right? Ear, nose, and throat doctor. I did my training in Brazil, my medical school, and then my ENT residence training in Brazil, in a city called Curitiba, that is in the
Mm-hmm.
south of Brazil.
Mm-hmm.
And then I moved to US, where I did a fellowship for around 1.5 years. I went back to Brazil, and now I'm in Dubai. Since 2017, I have been working in Dubai. I'm also a mom and a wife, and I'm completely passionate about helping other people to live better by helping them to breathe better, to hear better, and sleep better. Because I think those are fundamental for us to have a good life.
That's very exciting. Doctor, you mentioned breathing better. How
Yeah.
can we as humans breathe better?
So first thing, we should be all nasal breathing, right? We should not be breathing through our mouth. And why? Because the nasal breathing is very important in all phases of our lives. When we are kids, we need to be nasal breathing to allow the face, the bone to grow properly, the muscles around the nose to develop properly. And then this is important so we don't end up having facial deformities and other problems that can keep going, especially during childhood, that our face is being formed, right? So for someone that chronically, constantly mouth breathes, it can cause a lot of problems, especially during childhood. Then these problems are going to become permanent. For example, if the child keeps the mouth open, we have the upper part of our mouth
Mm-hmm.
that should be more or less like this, right?
Mm-hmm.
It should have a small curvature. But once you keep mouth breathing constantly, you force the column of air to go through the mouth. And
Mm-hmm.
then this upper part of the mouth starts to go up and higher to
Oh,
allow the air to enter. So then what happens? When you see the normal, you have a lot of space for the tea to come, right?
mm-hmm.
Once you start to go up and high, you see how the space
Yeah,
there
it
is a
will be
lot of
crowded.
reduction.
Mm-hmm.
Exactly. So then this child has like a lot of teeth that they don't feed them out, and they end up having to have orthodontic treatments. They need to expand the upper part of the mouth, so it causes a lot of problems.
Well,
And
I never expected that
yeah,
it has such an impact actually on how it structure our mouth. Now, this is in physical
and
terms. Does it have, let's say, any internal differences if we breathe via the nose compared to the mouth from, let's say,
yes, for
the
sure. Yeah,
efficiency of utilizing oxygen?
yeah, for sure. So this is like during childhood, we have this role of developing our face, the musculature around. So
Mm-hmm.
this is one thing that it's very important during childhood. But during our whole life, the nose has its basic function that is to protect the nose, right? So the nose has a function to purify, humidify, to be a barrier, to moisten the air and to warm up the air before entering through our lungs and through our bodies. So once we skip this barrier and this protection, we can have problems. right? We don't protect our lungs and we don't protect our body. Then it can be more predisposed to be sick, to have infections, and we can end up having more problems also in our lungs and in our body. So this is a basic function, right?
Mm-hmm.
And another problem that we have that when we tend to mouth breathe is that we tend to breathe faster,
Mm-hmm.
right? We end up breathing faster. And every time we breathe faster, we send a sign to our brain to say, oh, something wrong is going on. And something is wrong is going on. Then we end up activating our sympathetic nerve.
Mm-hmm.
So we have in the body two roots. We have the sympathetic and the sympathetic nerve system. The sympathetic is the stress, right?
Mm-hmm.
So fight, run, and let's go. And the parasympathetic one is the one when you calm down, when you release, and when we feel more calm.
I see.
Usually, if we mouth breathe, we tend to breathe very fast, faster than through the nose. And then we end up stimulating our sympathetic nerve instead of up-regulating our parasympathetic nerve. So it can, once the rate of the breathing is faster, it can end up generating more stress, more
Mm.
anxiety, and more problems as well. So this is
Doctor,
another route.
when we breathe faster, can I say that, for example, our cortisol levels increase because kind of we're tricking
Yes.
our brain that we're anxious and we're in a fight or flight mode, as you mentioned?
Yes, exactly.
Mm,
Exactly.
I see.
Yeah.
And now, speaking
Mm.
of which, something crossed my mind now. If we
Mm-hmm.
keep on breathing from our mouth, let's say, does that affect our athletic performance in a sense?
So, what we know nowadays is that the mouth breathing, but there are a lot of research, right, saying that for sure it's going to affect development of your face, it's going to
Mhm.
change the shape of the face, that it can be more predisposed to have infections, that because your mouth breathing, you can have more cavities, that you can have poor oral hygiene, more dental problems. And this is for sure. There are a lot of research showing that once you breathe slowly, there are a lot
Mhm.
of researches talking about these when you alternate the nasal breathing, the nose you breathe through one side and through the other side.
Mhm.
So then you slow the rate of the breathing, that these end up affecting positively the the
Mm.
cardiovascular system, stress, anxiety. So there are a lot of research showing about reducing the rate of the breathing can impact the cardiovascular and the stress and those things. A lot of research they were done through nasal breathing,
Mhm.
right? And they saw this good impact. About this comparison between mouth breathing and nose breathing, there are not so much researches
Mm.
comparing both routes, to be honest, right? I feel that in 2020, the James Nestor published a book called Breath. I'm sure you have read
Uh-huh.
this book, right? And I see this book emphasizes a lot about the importance of nasal breathing and oral breathing. So
Mhm.
people became more aware of the importance of nasal breathing over oral breathing, right?
Mhm.
And the book discuss a lot of things, the importance, the same things that I had mentioned. But when we go to a lot of research comparing both,
Mhm.
uh, we don't see that much, to be honest, right? We have some researches saying that first think about exercise. Are we able to nasal breathe during exercise? Because a lot of people believe that we cannot, right? We
True.
can. So, so there is research saying that we can nasal breathe during exercise. It's possible as long as the individual is healthy, which means that the individual doesn't have like a severe nasal obstruction, severe septal deviation, uh, allergy, then of course, then he can nasal breathe, right? If there is no obstruction in the airway, then the individual is healthy, he's able to nasal breathe. Then what we know is that, okay, so we believe, I think a lot of us believe that we cannot nasal breathe during exercise, especially, and that there is a tendency for us to, when the exercise gets more intense, then we switch to oral breathing, right? So there is research saying that in a low level of exercise, if the individual is healthy, he's able to nasal breathe. When we start to go to high intensity exercise, then there is more tendency to breathe through the mouth. But there is also one research with individuals that they were trained, right? They were used to nasal breathe and they were able to keep the nasal breathing. In theory, if you nasal breathe, it's much better because we end up, when you breathe through the nose, we produce much more nitrous oxide that is responsible for allowing the disturbance, to allow the oxygen to be released in the lungs and then into the blood through the muscles. Because when you're doing exercise, the muscles, they need oxygen to work. So it might help the performance of the exercise. It also, when you nasal breathe, you tend to use more our diaphragm. So the diaphragm does the work. So we don't need to use much accessory muscles related to the breathing. So we save some energy. And also we tend not to lose so much water, to not dehydrate. Because once we nasal breathe, we are able to moist our air 40% more. So we can, so in the tendency is that you don't lose so much water. So you're able to do exercise, not carrying like these 3 liters of water around, right? So this is what we believe, right? That's why breathing through the nose can cause the exercise to be more effective. But it seems that a lot of people, they might need training, adaptation on how to nasal breathe. On the low levels of exercise, we should all be able, as long as you're healthy, but as exercise intensity progress, we might need some adaptation, some training. That's why a lot of physios, they can work on that. The ENT can check if there is some reason not to be able to breathe through the nose, and then we can improve our performance, right?
Very interesting. Like I can kind of, let's say, think that breathing through the nose, because it increases the nitric oxide, the blood flow, and less water that we lose. In a sense, in theory, it should, let's say, enhance our performance because it increases the recovery rate, let's say. Speaking of which,
Yes.
yesterday I made a post asking our guests, sorry, our audience, that if they have any question to ask you as an ENT specialist. And one of them have asked how much can a sinus surgery in an average person improve athletic performance? So is it important that we do a surgery? For example, if our nose is deviated, does it affect our breathing if we do a surgery?
Excellent question. So I'll give you an example. I had a patient that used to do a free diving, but when he was going down, he was struggling to equalize the pressure through the nose. The nose was blocked, and then he was end up having problem in the sinus. So he came to me, I checked him. There was like a severe septal deviation, turbinates were enlarged, and he was feeling this nasal obstruction. After surgery, his performance improved so much. He started to go deeper and deeper and deeper. Same thing for runners, right? I have patients, to be honest, I have some patients that they were obese and I didn't know they used to run. And then like 1 month after surgery, oh my gosh, now it's so easy for me to run. Now I'm running 10 kilometers. And I look to the person like, whoa, I cannot run that. The person who's running. Oh, but it's great, right? So yes, if the person has a septal deviation, enlarged turbinates, or some sinus problem that they impact the breathing, then of course, once this is better, it should improve performance. are there studies telling me that okay, you're gonna do a surgery and the performance is gonna improve? No, there is no study comparing. And then you have to understand that sometimes it's hard to do research, right? How you're gonna do a research and compare? Why are you gonna do research to see sports performance? I feel that nowadays people are getting more aware of improving performance and then maybe might have some research. But that I'm aware, I don't have any research to tell to the patient for sure your performance is going to improve. What I see in my practice working as an ENT for more than 10 years, yes, it's improved, right? But I don't have research to guarantee, oh yeah, it's going to improve. But that's for sure. But of course, and then you might hear the patients, I did the surgery, didn't improve anything, right?
Yeah.
No, they're the other
Yeah.
way. So the first thing is the proper diagnosis. If the patient doesn't have much nasal obstruction, if the patient doesn't have a severe septal deviation, then this patient are not going to have benefits, right? It needs to be evaluated case by case, patient by patient, to see what is the best for each patient, what makes sense.
Fascinating. It's interesting actually to think that we haven't hit our limitations only because of our breathing. And because because I think that a lot of people have a congestion or have issues. A member of my family had, and they had the surgery and they felt way better after when it comes to breathing. Now, I want to get into the topic of sleeping. What is the
Mm-hmm.
role of a good night's sleep on our health?
So I think we all know, right? How is it hard to sleep bad for a few nights in a row,
Mhm.
right? Uh, you know that if you're tired, you don't want to learn, if you're irritable, anything can distract you. Um, things cannot go well. And this is for all ages, right? Especially for kids, because they should be learning, they should be at school, and then they are tired, they don't want to learn, they get irritability, and they start to fight with the kids, creates a lot of problems. And
Mhm.
same thing for us. So I think everyone knows the answer, right?
Mhm.
Everybody has experienced some periods of not being sleeping well. But also some people are not aware that they are not sleeping well. They don't realize because they think that's the normal way, right?
Mhm.
Oh, that's how it is. I wake up tired and that's normal. I wake up with headaches and that's normal. Actually, no, we should wake up refreshed. If you had
Mhm.
a good amount of hours of sleep, if we didn't wake up during the night, that's a proper sleep. We should wake up feeling refreshed, without headaches, with energy, right? And happy to start the day. So sleeping well, not just impact our mood, how we feel, but also can impact on avoiding the development of high blood pressure, of diabetes,
Mhm.
of yeah, there are a lot of diseases that not being sleeping well can trigger, of course, if it keeps happening for a long time, right? And same thing with snoring, mouth breathing, pauses during the sleep, they all can end up having problems in our whole body,
I
not
see.
just sports performance, not just learning performance, but also end up high blood pressure, diabetes, and other diseases as well.
Then the
So
question
it's
that, let's say, begs itself, how can we have a good quality sleep, let's say? What should we care for as normal individuals? Because if I ask people, how do you sleep? They would tell me they would just go ahead normally and sleep. Is there any, let's say, certain things which we should consider as strategies or, let's say, regimen for a good night's sleep?
for sure. If we should disconnect before from the electronic devices,
Mm.
from our concerns, from our email, WhatsApp before we go to bed, right? We should rest, we should calm down, we should have a routine to sleep, right? Is okay, always sleep on the same time, wake up in the same time. It helps our body to understand, okay, now it's time to sleep. Now I'm gonna rest. So there are small rituals that we can do that helps our body to calm down. Because during the day, usually modern society, our sympathetic system is flared up all the time, right? It's all the time email, WhatsApp, do this, that, we are always in this stress mode. So during that time, we should rest. Okay, now it's time to rest. Our parasympathetic nerve should go up and allow us to relax, first to have a good night of sleep. We should not have a heavy meal, like at least 1 hour before you go to bed, because then our body is gonna be trying to digest this heavy meal, right? We should have a space to rest and allow because when we sleep, our body is doing a lot of things, right? The body is producing growth hormones. The body is producing even the hormone that can help us how to feel satiated, that we are not feeling hungry anymore. It needs to this time in the night to be regulated. So our body is working a lot during the night. It's not that it's just not doing anything. So you need this rest time for the body to replace, nourish, and rebalance again. So then we can start well during the day, right? So what I see nowadays is that a lot of people have insomnia, which means that they wake up during the night for more than 3 months regularly. This is how we characterize it as insomnia. And then those people usually they go to bed right after a phone call from work, very angry, stressed, and they keep thinking, right? Oh, I have to do this tomorrow. I have to fight with this guy. I have to do this, that. No.
Yeah.
So I always say a simple thing, give some time, rest a little bit, put the concerns in a notebook. Okay, I have to do this, and this tomorrow. Tell to your brain. It's crazy, but you can tell our brain. Tomorrow, now I'm going to rest, and tomorrow I'm going to be rested, and I'm going to be able to take care of these things that I have to do. But now it's time to rest, right? We can tell our brain those things and put what you have to do in the to-do list. Tomorrow you get that and forget and go to bed. So there are small things that we can do that can help us to sleep better. And I feel that it's silly, but once we understand that sleeping better, we're going to perform better the next day, right? Because you are not going to be coming back and forth in our decision. You're going to make a decision once, then what happens is save time, right? So once you understand that when we are rested, when we are present, we're going to be more effective, more productive, then okay, then we accept sleeping better as well, right? And other thing that I frequently suggest to the patients that they are very agitated, that they cannot sleep well, is to meditate before going to bed. Because actually there are a lot of research showing that meditation can reduce stress, can reduce anxiety, can reduce blood pressure. So meditation is such a simple tool and that can help so much, right? And it's science-based. Because I'm a doctor, right? So I need to offer science-based options for the patients,
tools.
right? Yes, exactly. But meditation is amazing. It has such a powerful role in help people to sleep better, live better, be less stressed. It's amazing.
I can back you up heavily on meditation, actually, like in every aspect in life and reducing the stress levels. For example, sometimes like a walk alone with your thoughts could be meditation. Journaling could be meditation. I spoke to some people and they told me like listening to music for them is meditation. So each individual has like a certain action where they have the capacity to clear their mind and recharge in a sense. Yeah.
Yeah,
While we
exactly.
were
No,
talking about sleeping, you got into the topic of snoring, which I think is like something on the minds of many people. So how do we snore? Why do we snore, basically?
this snoring is produced by like some obstruction in the upper airway, which includes the nose, the back of the nose, the back of the throat, and the neck that you have the trachea. So for some reason, if there is some obstruction, this airway, instead of being completely open, it starts to reduce. And then once the air passes by, it makes noises. That's when we have the snoring. This snoring, the snoring is usually the first step for something that concerns us a lot. That's the sleep apnea. That's the pauses during sleep in the breathing. So the snoring is like a red flag. Oh, okay. Is this person having sleep apnea? And of course, the snoring annoys people around.
Yes.
But it's also a red flag to say, oh, is there sleep apnea going on there? And the snoring can be caused by can be temporary, right? So if you have a cold, if you have an allergy, you might be snoring. If you're too tired, sporadically, if you had some drinks, you can be snoring. That's fine. The concern is what you call habitual snoring. That's the one that happens 3 or more times per week. If it's happening 3 or more times per week, I would say check with your ENT. Then it's better to check because it can have a lot of consequences long term if it keeps happening.
I see. Sleep apnea actually is something that I read about once, that it affects the sleep quality and our breathing, that it sometimes like cuts off the breathing for a bit. And sometimes people like wake up out of breath because of it.
Yes.
Now I want to get into the topic of, let's say, our ears, listening, the capacity to listen, let's say. Is it something that, like our eyes, the sensation of, let's say, seeing, we can lose via time as we age? Or do we have always the same capacity to hear throughout our lifetime?
Yeah, very, very interesting question. So there is a tendency that with age, we have some hearing loss that we call a hearing loss related to aging, right? So there is a tendency for this to happen. But what I would like to emphasize is that I feel that we are not aware of the importance of being hearing properly, right? In all ages. So we have mainly 2 ages that are under more risk for hearing loss. That are the kids, because they can have frequently what you call glue ears. Glue ears is when they have fluid behind the eardrum that doesn't allow the sound to keep progressing through the ear, to the eardrum, inside our ear, and then to the brain, so then you can hear. The kids are more susceptible to have glue ears. And if a child is not hearing properly, this child cannot learn how to speak because you're not hearing. And if the child is not hearing, she cannot participate with other kids, cannot play, cannot learn. When people talk with this child, other kids talk with this child, the child doesn't understand. So maybe someone is just asking, can I have this one? And the child is not understanding and is holding the thing, right? Then the other one gets upset. So they can cause problems in behavior, can cause problems learning in the development, speech, also writing, reading, because they don't hear well. They can be, or some kids are just distracted. Oh, they're just distracting their own world, but they are very peaceful. No, they're not hearing. And it can affect so much that if there is any concerns about the hearing, so what the guidelines say is if the parents, if the teachers, if the pediatrician, they have any concern about the hearing, if you're not sure, it's better to check because it can impact so much this child. So this is for the kids. And then another group that is very susceptible to hearing loss are old people, right? Older people, as you said, because of with the aging, the auditory system starts to have some problems. And for these kind of people, they of course they know how to speak already. Their speech is fine,
Yeah.
but how do they start doing? First, they're gonna suffer more in noisy places because there's too much noise, and then it's hard to understand. So let's say Sunday lunchtime, all the families together, everybody's talking. This person cannot hear well. So what this person is gonna start doing? What? It's gonna ask to repeat. Okay, then red flag, right? What? Okay. In the beginning, the person's gonna start to ask what, but it's gonna reach a point that the person's gonna be ashamed to be asking to repeat. It's gonna get tired to be asking other
Very
people to
true.
repeat. So what's gonna end up doing? The conversation's going on, and the person's like
Smiling and nodding.
just smiling. Yeah, it's not there, right?
Yeah.
Physically it's there, but it's not participating. And it's really sad because it can trigger to depression, isolation, and then it can, sometimes it's a very active person, very healthy, that is still working. The mind it's amazing, keep going, but because it's excluding this person from conversations, from everything, it's not helping the brain to keep going on.
Mm-hmm.
So it's a big problem. So whenever there is a suspicion of hearing loss, better to check, right? Usually to do the hearing test is a non-invasive test. Just put the headphones, there is a noise, and press the bottom. That's it. Why not gonna do that, right? No reason. But it needs to be checked because hearing well is really important for all ages.
Mm.
If there is any doubt, any concern, better to check with the ENT.
Doctor, is it reversible? Like via
So,
time, can we reverse it somehow?
Depending on the cause,
Mm-hmm.
yes. For the kids, usually it's reversible. For the kids, usually they have some what you call glue years. Then it lasts up to 3 months, and then it goes away by itself because the human body can heal, right?
Mm.
The human body is amazing; it can heal by itself. So usually the human body knows how to make this fluid to go away, and then the healing comes back to normal. But if the fluid stay there for more than 3 months, and if the fluid it's impacting the development of the child, it's causing hearing loss, or there are signs that you can tell that this hearing loss can become permanent, then you might need to do a surgery to remove the fluid from there. And then you put a tube that you call grommet, so it allows the fluid to drain and not recollect again. That's just a temporary, the tube stay there just temporary. And then this usually solve the problem. And we see the result like we do the surgery, like we did
Immediately after.
yesterday, and yes. And then it's immediately, it's amazing. It's really gratifying. So this is for the kids. So it all depends on the cause. For elderly people, the problem is in the nerve, right? The nerve that gives hearing is not working that well. So unfortunately, usually it's not reversible. But to be honest, if you have to decide between having a problem with the hearing or with the eyes, better to have with the hearing because there is always a solution. There is always a solution, right? You can put some hearing aids and then you're gonna be fine. Unfortunately, the eyes, there are some situations that we cannot fix, but with the hearing, usually there is a way to improve the hearing.
You know what? I want to ask you about something. I myself, I didn't have any hearing problem ever. Now I'm 31. Or when I was like maybe 14, 15 years old, I was sleeping and on my left ear, I woke up and ever since I can't hear perfectly in it. I always hear this, let's say, echo. And I've been to a doctor and I don't mean any disrespect, but they prescribed me vitamin D. I was like, although like I go a lot to the sun and I did use to supplement for vitamin D. And ever since, my hearing didn't come back, only my left ear.
Wow. So did you have pain when it happened? Did you have a lot
Nope,
of pain in the
no.
not sudden?
I literally just woke up and my ear just had this echo. And ever since, I still have it until now.
So probably you might had what you call sudden hearing loss. Did you do a hearing test after that?
I actually did. They did a hearing test for
Mm-hmm.
me, and I wasn't hearing properly in it. It's like
Didn't
someone is
it?
talking from very far for me.
Mm-hmm.
Yeah,
Yes. It seems by what you're telling, and the eardrum is fine, no perforation, nothing like
nothing.
this. Yeah. So probably you had what you call sudden hearing loss.
Oh,
That
wonderful.
suddenly you had some hearing loss. We don't know the cause.
Mhm.
Then you just have to investigate to see if there is anything, if you don't need a surgery, because if there is nothing compressing the hearing nerve. And then usually once there is sudden hearing loss, we need to start the treatment with steroids as soon as possible to see if the hearing nerves get better. I don't know if you had the chance to do this at this time,
No,
because now it's a
actually,
long
I
time,
actually
right?
ignored it because it didn't affect my life heavily.
Oh,
I was like, all
yeah.
right, I have another one which is working.
No, now like after a long time, we cannot use medications anymore.
Yeah,
Medications are not going to help. Unfortunately, there is no medication proven to help, right? The problem, so now you have, but you might not have a completely hearing loss in one side. It just might be like some mild or moderate hearing
mind, yeah.
loss in one side, right? But you can use some strategies, right? Like if you go out for a restaurant, you can put the ear that you don't hear so well.
Mm.
You can put this ear to the wall, so it's easy for you to hear people around you.
Yeah.
Because the problem with this imbalance between the hearing is that you might be struggling to know from where the sound is coming, right?
Ah,
Do you feel
yes,
that?
yes.
You don't know, maybe someone call you, you don't know from where.
Very
Because
true.
this localization, yeah, because this localization of the sound, it depends on both ears. And then one is telling one thing is not, you don't have the completely information. So
Yeah.
whenever if you go to a place with more people, or even if it's one to one, you can always put the bad ear to the wall,
Hmm.
because then it's easy for you to hear with your good ear. You can do that.
You know what? I actually use the same strategy when I sleep because
Oh,
I have
really?
these earring plugs. So while I
Uh-huh.
sleep, sometimes one of them falls and I don't want to look for it in the bed. So I put the earplug in my good ear and sleep on my bad ear.
Exactly. You use your natural earplug, right?
Exactly.
But interesting.
Uh,
But do you have sounds in the ear? Do you hear like pee, something like
I
this?
hear
No.
like shh, like
Yeah.
like an echo always,
Mm-hmm.
like a white
Yeah.
noise
Cause
kind of thing.
yeah, we call it tinnitus,
Hmm.
right? It's a sound that doesn't exist, but because of this difference in information that you get from one ear into the other, this sound comes. It's a sound that doesn't exist. Don't pay attention on that. It might be worse in quiet places, probably, right? Yeah, just if the sound doesn't exist, just relax and
Sure.
then it's fine. Yeah. But anyway, if there was something that you want to do, like probably hearing aids would be an option. There's always something to do to improve the hearing, right?
Mm.
But
Thank you very much, doctor, for that.
unfortunately, might be permanent. That's yeah.
Well,
What you
that's all
can do
right.
now, you can prevent more hearing loss,
Mm-hmm.
right? So you can avoid being exposed to loud noises.
Mm-hmm.
Um, so you can protect your hearing. Don't try to avoid being exposed to loud noises. The louder the noise and the longer time you're exposed to the noise, there is more chance to damage the nerve that gives us the hearing.
I see.
So avoid louder noises, avoid staying longer time in noisy places, then you protect your hearing as well. And because age is gonna come for all of us, unfortunately or
Yeah.
fortunately, right? Because if we don't age, the other option is not good, right? Then we're not here. So better that we get older. But I feel that we should be aging in a more proper way,
Yeah.
right? Healthier way. So take care of your hearing. Don't abuse so much of loud music, loud places. Of course, sporadically it's fine, but right, just take care of the hearing so it doesn't get worse.
Wonderful. Thank you very much for that.
Mm.
Doctor, throughout my conversations with different guests, for example, when I used to speak to dermatologists, psychiatrists, they always emphasize on how stress affects our life. For example, how is it that it's slowly deteriorating our capacity, our optimal capacity as humans? Where does stress fit in ENT?
I totally agree. The stress nowadays, it's a huge problem, right? What I see in my practice, what people come to me and stress is the root cause, it's mainly recurrent throat pain.
Hmm?
So they have a lot of recurrent throat pain. And when I check, the throat is completely fine. Sometimes there is a little bit of redness, but it's usually because of stress triggering reflux. Reflux, so the acidity from the stomach can come up and then can irritate the throat, so they can have recurrent throat pains without fever. I see also a lot of dizziness,
Mm-hmm.
right? Especially when people are having burning out. They're having burnout.
Mm-hmm.
So they have this kind of dizziness that they go around. They come for a fifth opinion because everybody say that everything's fine. They cannot find the cause. But then when you go through a deep conversation, is the stress with work and stress with life and is just stress. There is no other cause for the dizziness. Sometimes also a lot of recurrent infections, because once we are under stress, our immune system cannot work that well,
Mm-hmm.
and then easily we can get sick. And then just to give you an example, right, when COVID came, I'm an ENT, so I was seeing people without mask, coughing on my face, like
Mm-hmm.
for many months, and I was fine. And for sure, people had COVID. And then, okay, COVID appear, and then, okay, you have to have the precautions and blah, blah, blah. But after many months, when I had some personal problems, when work was very stressful, I got COVID.
I
Like I was
see.
exposed all the time. But then when I had some of these personal problems, stress at work, my immune system went down and I got that.
Wonderful.
So it
Fascinating.
also it predisposed us to get more infections. And what I feel, what I have been learning through seeing a lot of patients, through my own journey, is I believe we are addicted to stress.
Hmm.
So that's
Also,
why it's also hard. It's also hard to release the stress. I believe we human beings, we believe that we are successful if you have a lot of stress. If you have a lot of meetings, a lot of things to do with
mm,
work, then we are successful. Don't you think so?
actually, I agree 100% on what you said. Somehow, I think that humans have the tendency to self destruct, meaning they know that something is bad for them, though they still do it. And then they somehow complain of why something is happening for us. Just like smoking. People know that it kills us,
Exactly.
yet they take it. And they know that something is bad for them, yet they try to overcome it by being stubborn or like overcoming the difficulty somehow.
Mm. No, it's the human mind is amazing, right? So I feel that stress has a huge impact, is the root cause of many things. Oh, there is another one that I forgot that I see a lot here, is people with headaches. So they
Mhm.
come, same thing, third, fourth, fifth opinion, headaches, don't know what's going on. And then they believe it's sinusitis. I say it's not sinusitis. I prove to them what's going on. Because of the
Mhm.
stress, they're grinding the teeth, pressing the jaw, they have bruxism, and they have headaches. Root cause is stress. There is no other
Mhm.
root cause, right? So these I see a lot. And then they have ear pain as well. They have pain over the face, pain over the head, sometimes on the neck, shoulders, everywhere, because the musculature is all connected. So once you grind the teeth during the night, you can have pain everywhere, right? As I say to the patients, it's almost like you are running barefoot, right? You're running and then you're barefoot and you're not prepared for that, and then you're gonna have pain everywhere. So instead of being resting during the night, you're running.
Yeah.
So it doesn't help. But I feel that we need to overcome, first of all, we need to overcome this belief that being successful is being stressful and it's being to have to do a lot of things, right? Because if everybody can go through stress, even doing simple things. Even someone that has just to do like 3 things in a day can be stressed. Oh my gosh, I'm stressed. Maybe I'm not gonna do in the right order. Maybe I'm not gonna have enough time. We can find stress everywhere. And we believe it needs to be like this. And if you're not stressed, you're not successful. So I think we need to drop this belief.
Yeah.
To then understand that you can live without stress and that you're gonna live much better.
They're
But it's
living
not
like in a
easy.
sense where, because of too much stress, they think that they are producing or being productive somehow.
Yeah,
And people are addicted to being productive. They
exactly.
need to always be busy somehow.
Exactly. I totally agree. Yeah, totally agree. And if you think about when you are under stress, you don't make the best decisions,
So,
right? You you go back and forth on the decisions. You don't do the best decisions. And that's why I said like meditating, being present in the present moment, it actually increases our production, right?
yeah.
So we need to understand that it's not just to avoid diseases, right? That, as you said, a lot of specialties, doctors, specialties are saying that the stress can trigger diseases, but also to live better, to produce more, and to have a happier life. So we need to find a way to reduce our stress level. I think that's our main goal as a society nowadays.
I completely agree, doctor. Like, if there's something that I can emphasize heavily on, is managing stress. I heard from many people how stress can have them have, let's say, bad thoughts, deteriorate the health, and how better they feel on a good day where they are, let's say, stress free. So yeah, that's a very important thing actually to emphasize for people.
And understand that being stress free doesn't mean that you don't have a lot of things to do. Doesn't mean that you don't have a lot of problems to do. It's just you are there at the present moment and you are calm, right? And one thing that I also think it's interesting is that the brain doesn't know what is true and what is not true. The brain doesn't know what is true and not true. That's why also stress is easy to be triggered. There is there is an experiment that they did. They divided people in 3 groups. So they teach it to everybody how to play a song in the piano. They did MRI in the brain of all participants, and then and they said to one of the groups, every day, I don't know, 2 p.m. you go and play the song. To the other group, every day, 2 p.m. you go, you play the song in your mind without the piano, just in your mind you play the song. And to the other group, do whatever you want 2 p.m. After some time, they bring back the participants and they did an MRI. And what it showed is that the group that was really playing the piano on piano activated some areas in their brain, the same as the one that was just imagining playing the
No
piano.
way.
So the brain doesn't know what is true or not. And if you enter through this loop stress, for the brain, it's fight and run all the time. And stress can be true and cannot be true, right? Of course, we have the stress of okay, there is a lion come here. That's
Yeah.
true stress. I need to be feeling fear. I need to run. But there is the stress of, oh my gosh, I don't know, maybe someone is gonna come here and it's going to tell me that I cannot stay in this room. That's not true, right? We create things. We create, and the brain doesn't know if it's true or not. So
I
we
see.
need to watch our mind. We need to watch our mind. As I said, the bad thoughts, what is coming, that's our mind. If we don't understand that the mind is like one of the organs, it's like the heart, it's like the nose, we're going to keep on this stress level. I think we need to be more aware the power of the mind.
You know, I just remembered something when you mentioned the stress and how the mind doesn't understand which is which. I once read that, for example, if you saw a bear in the wilderness, when you run, you will feel the fear. Not because you are afraid that you run. So, for example, like the action comes first, then the reaction in your mind comes automatically. So you run first, then you feel the fear because your hormones and the adrenaline came after. Speaking of what you mentioned, yeah,
Yeah, exactly. And it then went in the flow, right? You
yes,
are the flow of stress. Exactly. It's like, for example, if you're gonna present a lecture
hmm,
to a lot of people, once you go to the stage, if your heart starts to accelerate, but you feel stress,
yes,
right?
yes,
You enter in the loop of stress. But if you calm down, then yeah, but it's all connected. But I feel um, that the medicine we need to emphasize more that the mind is like an organ,
mhm,
and the mind has a lot of power over our brain, and that the brain doesn't know what is true and what is not true. So we need to treat properly the mind. We need to treat the mind as an organ and take care of the mind.
pretty fascinating.
Because people are getting more stressed, sicker than ever. It's it's very sad. It's very sad.
Dr. Annelies, I can't thank you enough for the information that you presented today. I truly, truly have enjoyed talking to you. Is there anything that you would like to share from Dr. Annelies, let's say from your life experience, to the people out there, something that maybe you have learned through life and you would like to share before we close up the episode?
Yeah. So I think one of the things that I have been learning, I'm very curious.
Hmm.
So I like to hear patients. I like to observe how things go. Is I believe we need to trust more on our body because our body has the power to self-heal. We need to trust, we need to hear, and we need to respect more our body. So then you're gonna live better and avoid diseases. So this is my message, right? And I would like to say thank you so much as well. It's such a pleasure to have this fascinating discussion with you. It was really, really nice. I hope we can raise more awareness
Yes.
about this topic and help people to live better and happier, right?
Thank you so much, Doctor. I wish you all the best and nothing but happiness for you and your family. And I hope to talk to you maybe later on in the future. Until then, all the best for you.
For you too. Thank you so much.
Thank you very much, Doctor. Bye bye.
Thank you.